All right, and welcome back to another episode of HealthSparx, my exciting new show that features the brightest entrepreneurs and innovations from the health and technology arena. I am Michael Walsh. I'm your host. Super excited to be back. I've been gone here the last week or two working on getting my startup launch, CareLoop. We just finished up the development last week, got it launched. Check it out at careloop.com. Would love some feedback on it. It looks great. The feedback so far from the customers has been really good. So super excited that that's out and that I'm back and able to talk to you guys. We have an awesome show today. If you have any interest in business, technology, healthcare, definitely want to stay put. I've got awesome guests planned for today's show. It's the CEO of KaiNexus. It's Dr. Greg Jacobson, a doctorpreneur, as I'm kind of referring to him as today. Based out in Austin, he works for Seton. He's an emergency room doc, but he's also the co-founder of this awesome company based here in Dallas called KaiNexus. And also, it's going to be a two-guest show today. We've got the Chief Improvement Officer of KaiNexus, Mark Graban, who I'll read these guys' full bios here in a couple of minutes. But I mean, Mark, he's done so much. Like his resume is also just pretty ridiculous. He's been involved. Let's see, he went to Northwestern. He went to MIT. He's written books, he's consulted, he's spoken, he's like considered an expert in lean startups and lean healthcare. So these guys definitely know what they're talking about. So stay put. This is going to be a great show. A couple quick thanks as always. Satori Tech Solutions, my development guys. These guys have been fantastic. The website looks great. Everybody that has stopped by so far, friends and family, and even just the random people, all comment on how great it looks. So thanks, Satori. You guys are awesome. And Health 2.0 Dallas, this is a group that I lead here locally. Same type of mission as HealthSparx, really trying to gather that group of health, technology, business. You know, it doesn't matter what interest or what area of any of those things that you lie in. If you have an interest in any of those things and you like meeting folks from these networks, you need to join this group. You need to go and sign up at our meetup group to get all the updates. Check out the website, health20dallas.com. We'd love to have you out. So, yeah, again, today should be awesome. I'm really excited to be back with you guys. Let's get started with the show. All right, everybody. Today on HealthSparx, I've got two healthcare rock stars. I mean, seriously, these guys' resumes are absolutely fantastic. We've got Dr. Greg Jacobson. I want to quick read Greg's bio, and I'll introduce him, and then we'll go into our second guest. Greg graduated from Washington University in St. Louis in '97 with a BS in biology. He then attended Baylor College of Medicine from 97 to 2001. And then from 2001 to 2004, he completed his residency in emergency medicine at Vanderbilt University Medical Center, where he then stayed on as faculty. Starting in 2004, it was his observation and research of operational inefficiencies and unrealized improvement opportunities that resulted in the creation of rudimentary software tool at VUMC, which is, I'm guessing that is the Vanderbilt University Medical Center. And ultimately, this was the founding of KaiNexus. And Dr. Jacobson is the co-author of Kaizen, a method of process improvement in the emergency department, which was published in the journal Academic Emergency Medicine. So, Dr. Jacobson, welcome to the show, my man.
I'm really happy to be here. Thanks.
And then we've got kind of a 2-for-1 here on HealthSparx today. We've got Mark Graban, who works with Dr. Jacobson on KaiNexus. Quickly reading his bio, it's also just ridiculous what these guys have been doing. Mark graduated from Northwestern University, I'm guessing from my hometown of Chicago, in 1995 with a BS in industrial engineering, and later headed over to a little school called the Massachusetts Institute of Technology, MIT, where he got his MS in mechanical engineering and then an MBA as well. He is the author of Shingo award-winning book, Lean Hospitals, Improving Quality, Patient Safety, and Engaging Frontline Staff in Sustainable Continuous Improvements, which was published in June of 2012. And Mark has worked as a consultant to healthcare organizations throughout North America and Europe, teaching and implementing Kaizen and other lean management practices. And also, real quick, he is a fellow podcaster. He knows all about this stuff. He's got a great podcast, leanblog.org. Definitely go check that out. I've listened to a bunch of episodes. Especially the last couple of weeks with getting HealthSparx rolling here. It's been great. So, Mark Graban, welcome to the show.
Michael, thanks a lot.
This is awesome to have you guys. Thanks so much for taking the time. I mentioned KaiNexus here in the pre-call, and just as we've gotten going, it's a startup. I mean, do we even still consider it a startup? Are we past startup at this point?
guess it depends on who you're talking to. If you're talking to someone in Austin, we call it a startup.
Yeah, they launched it. It's been about a year and a half now, or about 2 years since we put the product out. But they operate it like a startup. I mean, it runs small, but it's lean. It's going. So KaiNexus. Let's jump right into what KaiNexus is. I'm going to start with Dr. Jacobson. What is KaiNexus, and why does this thing exist?
Yeah, so KaiNexus it's a web-based platform, so it's an improvement environment built specifically for healthcare organizations, but we're actually finding it works in non-healthcare organizations. And what we're trying to do is to make improvement easier. So we recognize that improvement is really difficult to do, and to create a culture of sustained continuous improvement is really difficult. And so what we're trying to do is make that entire process easier for organizations. Awesome.
So, and right now especially, I mean, there's just so much change and improvement needed in healthcare these days. So this is such an essential tool to what's going to happen in healthcare the next 4 or 5 years. So I'm kind of curious, I always like to ask startup founders what that moment or experience was, and we briefly touched it in your bio. What happened? And it would have been, 2004 or whenever it was here, what happened that made you start to kind of see this problem and think, there's got to be a way to do this a little bit better, that led to ultimately what is now KaiNexus?
Sure. So when I started my faculty position, every faculty member of an academic institution needs an academic focus. And so my chairman handed me a book by Mizaki Imai called Kaizen. And he handed it to me because I was always the what if guy. Why are we doing it this way? What if we did it that way?
Yeah.
and what Mr. Imai lays down in his book are just fundamental improvement principles. Things like, hey, let's decrease variability in the system, or let's identify unnecessary steps. And you know what? The best person to actually do all this is the worker themselves, because
Sure.
The worker is the expert in what they do.
Right, absolutely. And again, everybody listening, this is Dr. Jacobson. He's an emergency room MD, so he's not just looking at this from that business point of view. He's a clinician himself. So, he sees these things every day and probably sees all the different opportunities that the health system could make. And I'm the same way. Every time I walk into anywhere, I'm always like, there's got to be a better way for this. It's just that sort of entrepreneur type of eye that we have. So KaiNexus, again, it's based here in Dallas. I'd love to kind of just get into a little bit about some of the improvement opportunities that KaiNexus could potentially help a provider with. So maybe we'll stick with Dr. Jacobson for this one, and we'll get over to Mark here in just a second. But what can KaiNexus really do?
Right. So what we do the best is we help drive observations and opinions and problems that frontline staff find, and we make sure that it's really easy to follow those up and to track them and to report on them. So, for instance, an example, we call them opportunities for improvement. Someone's stuck in the system that, hey, they realized that we were actually entering in orders incorrectly into the ordering system, and it was producing a problem with billing. And that problem was actually costing the hospital $40,000 a month. So that was a frontline staff that made that observation. That saved tens of thousands of dollars for this hospital. So those are the types of things that we find. We find sometimes things end up becoming a little bit more complex, and so KaiNexus can help manage an entire project with an entire team of people and a lot of moving parts. But what we're really trying to do is make a platform that's inclusive, it's transparent, it allows easy tracking and easy follow-up, because really we all know healthcare is broken. And
oh yeah, totally.
we can all come to the table and start fixing little things, and after a week, a month, a year, a bunch of little things end up having a huge amount of impact and really make it so much more pleasant to work in an organization.
Absolutely. Now I'm curious, the example you used here was a little bit more of a kind of back-end business office-y CBO type of example. Can it help improve with both administrative as well as clinical tasks within a provider?
Yeah, it really once you teach your staff some basic methodologies and concepts on improvement, you're going to find that they're going to find all sorts of issues. They might put things in, the the shower curtain in the call room is too short and there's water on the call room floor every time, and that's a safety hazard.
Right.
They might put something in, hey, I recognize that these two medications have similar labels, and I almost gave the wrong one. Why don't we ask pharmacy to relabel this medication? And so really the breadth of what people are putting in is extremely wide, and really at the end of the day, the individual staff at the front line know the biggest areas that need to be addressed.
Sure.
So letting him guide you and letting him identify those things is a great way to just realize just huge cost savings and safety issues and satisfaction issues for an organization.
Totally. And again, you're so right. Like all these little things, they add up to a big thing, right? And if you could catch them and communicate, what the issues are and actually collaborate amongst departments, because that's also a huge issue in the hospitals and in the providers, right? Just people change jobs, people change positions, people are in, they're out, they're moving around. And, if you had a system that could keep everybody straight what the issues were, these things get solved, which equates to dollars.
Absolutely. And right now they're trying to solve these things in email,
right,
shared drives.
Yeah. Oh, and I mean, we know what happens with emails, right? I mean, you send an email and it just gets lost in the pile. So I want to bring in Mark. Has sat here quietly. So Mark, I mean, you're the Chief Improvement Officer for KaiNexus. So what does that mean exactly? What's your role here with the company?
Well, I mean, it's a startup-y title. I mean, we're a small company, so I mean, I focus on helping our customers learn about improvement. I also focus, working with Greg and the rest of the team on our continuous improvement within KaiNexus. But my background is different than Greg's. I'm an engineer. I've worked, for 10 years in industry before getting into healthcare for about the last 8 years. But there's such a common thread, and when I got introduced to Greg, actually by a blog reader of mine, to have this shared interest and this shared perspective coming at Kaizen from different perspectives, but reaching this common ground, it's really exciting working with Greg and being involved with all of this.
Yeah. Now, again, going back to your bio, you are, I'm going to use the word, expert's a good word, I think. I mean, just based on, you've done consulting, you've written books, you've written articles, you blog, you podcast. I mean, all about this concept of running a lean operation. Mm-hmm. So I wanted to get into that a little bit because, it's especially on the business entrepreneur side, there's all sorts of books out there about, starting up a company lean. And so I want to kind of explain to everybody, what does this mean, this lean concept? And just in terms of healthcare then, what does it mean? Mm-hmm.
Yeah. I mean, lean has its roots. People generally credit the Toyota automaker and the Toyota production system or the Toyota Way management system. But when you look at principles, lean is lean. I discovered that when I got into healthcare. I've had a chance to meet, when I first saw Eric Ries present late 2009. I saw a flyer. I went to his talk and I think, this is just going to be some superficial buzzword. But I was very impressed that the lean startup methodology, as Eric articulates it, I think is completely consistent with lean in other areas. And I especially appreciate how Eric emphasizes, that lean does not mean cheap. And that's certainly true in healthcare. The problem with the word lean in everyday vernacular, people think, lean means, not having enough resources. When you see headlines and that say, "Oh, we're living in lean times," what they mean is, we don't have enough money, we don't have enough jobs.
Yeah, it's negative connotation.
Yeah, and so lean, as practiced in startups or in manufacturing or in healthcare, it's really about being faster and more agile and having better quality and better meeting customer needs without being bigger than you have to be, without having waste, I think is the general principle that applies equally or just as well in every industry.
Right. So I'm curious now, this is kind of a good tie it all together type of question from both of you. Maybe we'll start here with Mark again. But how have we used that type of thinking and methodology with KaiNexus, and both in getting it started, launching it, and now running it and growing it? I mean, it's the whole lean principle doesn't go away. It's supposed that's the beauty of it. It's supposed to remain baked into how you run the company all along. So What are some ways we've built it into KaiNexus?
Well, I mean, and certainly, I mean, Greg was there at the founding. I wasn't, but I think some of the lean startup principles that apply to KaiNexus is that the company was founded not because we have this cool technology, but it was based on really deeply understanding a customer problem. Greg lives daily life as a doctor. I've lived it differently as a consultant, but I've been in the trenches with nurses and pharmacists and other staff. We understand the problem statement, and I think it's a compelling problem to be solved. And then I think there's the idea of we've been following Steve Blank's methodology on customer development of trying to developing and improving our sales process over time, and actually looking at it as a process and figuring that out before we hopefully in the future here are now ready to scale, because we think we understand that process pretty well. And back to Eric Ries and Lean Startup, it's all about cycles of learning, and so we're constantly looking at what's working, what's not working, what can we be doing differently. Having a vision that Matt and our co-founder, or that Greg and Matt, our other co-founder, the CTO, have a very strong vision, but at the same time we're very responsive to what customers are telling us. I think that's what makes us lean.
Yeah, and that's a good way to kind of bring Greg back into this. I mean, going back to the very beginning of this, Greg, like when you guys were putting the initial minimum viable product together, as Eric and a lot of the lean enthusiasts call it, you got to make a lot of mistakes when you put a product like this together, when you use the lean methodology. So what were some things that came up at the very beginning that you guys were crawling through as you put it together?
Yeah, one of the there are hundreds.
Yeah,
totally. But one I think is a nice example of what you're talking about is we were initially sending out way too many emails out of the system, and so one of the things we do is we're constantly trying to engage with our users, whether that's through kind of interactive training, or that we spent literally hours and hours and hours a month just watching people work in the system, learning what they're clicking and how we can decrease clicks and what's intuitive and what's not intuitive. But we were sending way too many emails out, and so we actually developed a digest feature that instead of blasting you with an email every time something happened in the system, we actually build all that up through a 24-hour cycle, and then we send it to you in the middle of the night so you can kind of read what we call your daily digest. Right. And if you do, there are certain little things that are sent out of the system, and also a user can force an email to come out of the system as well. But that was, I think, a really big thing that we learned with regard to this. And let me just add to a couple things that Mark had said, how we're lean. One of the things that we do is we use KaiNexus, our product, internally. And so we're constantly in the learning and changing process of KaiNexus. And also our development methodology is very much in line. People refer to it as agile, and we're an agile shop, releasing multiple versions of the product every month. So there's a couple other things that I wanted to add into the opportunity there.
All right. I mean, and that's all good things to be thinking about for a startup company. Just you got to be able to make mistakes, and you got to be able to kind of test yourself. And it's awesome that you guys are actually using your own product, right? Because especially you, Greg. I mean, you're right there. You're in the front lines. You get to kind of see all these things in action. So that way you can really quickly adjust as you need, especially with the product.
Yeah, so I'm actually an actively practicing emergency medicine physician. So we use the product when I practice emergency medicine. I'm still doing just a few shifts a month. And so I get to see the use of the product working in a healthcare environment. But then internally in the company, we're also using KaiNexus. And we learn different things from both of those experiences. And I just can't emphasize enough, talking to people that use your system is the best way to learn about what people like and what they don't like and what they want.
That is exactly what I was going to ask. But I was going to start with Mark on this one, just because he is the Chief Improvement Officer. But what's the feedback with this? Because I also, whether you guys realize it or not, I don't know if I've mentioned to you, but I also come from the healthcare consulting world. That's what I did for 4 years before I got into the startups. And anytime you ever sit down with a client and you have the conversation about you're doing this. This is what you're doing. This is your current state process, and this is kind of where we need to be if we want to be at this level of maturity here in your business. And oftentimes they get very, defensive. They get very upset. They feel overwhelmed because there's just so much change going on. They're not sure how they're going to, keep up with it. So that's kind of still going on here in healthcare, especially like with, my own startup. We sit down with people and we talk about something new and, well, this is how I've always done it. So what's been the feedback with this thing as you put it in front of your customers? What have they been saying about it?
Well, I mean, this is, I think, a challenge a lot of startups face. We as we demo the product for people, the product, the technology works, and we have customer data that shows the results that they're getting from it, and so we very rarely have to get anyone over the hurdle of would this help them. What we're facing is a market where there's a lot of uncertainty, there's a lot of chaos with all of the health reform changes, with all of the business pressures, with all of the new technology like electronic medical records that hospitals are still, even today, putting into place. You're competing for mind share, and you're competing for, you're trying to get people to say not only, okay, yeah, we see how your product works, it makes sense. Do they believe they can make it work in their organization or not? Which comes down to, often questions of leadership and culture. And when people say, well, this would work, but we're not ready for it. So we're trying to help convince people that continuous improvement is important. They have to make time for it. They have to make a priority. And this is going back almost 100 years. Old quote from the auto industry of whether you think you can or cannot do something, you're probably right. And so we hear what in a way is some self-defeating talk, and it's hard to convince people to view things otherwise as a vendor and a technology provider. That's our bigger challenge than questions about does it work or not.
Right. Yeah. And it's going back to it again. Just there's so much going on right now. To put one more thing on some of these people's plates, it's asking a lot. But if it's, at least from what we've learned, if it's easy and if it makes sense, not everybody's going to jump on and buy it, right? But if it's going to help somebody, then, that's the goal, right?
And to add on Mark's comments from our potential customers, I wanted just to give you a flavor of some of the feedback we're getting from our current customers. So we're up to just shy of 20 organizations now, and what we're hearing from people is that KaiNexus is allowing them to do more work in less time than they were doing before using methodologies or technologies like email and shared spreadsheets. And the other big thing is we notice people talk about we went from a complaining culture to a problem solving culture because there's an outlet now. So people really don't have the excuse just to sit back and complain about a problem, but when they are able to come to the table to fix things, then all of a sudden people roll up their sleeves and say, yeah, no, I'm happy to help out with this. So I really think we're starting to see the beginnings of how a methodology and a technology can change the underlying culture of an organization.
Cool. So taking a little bit of a bigger picture stance now, we'll go back over to Greg. From a little bit of a more startup and business side of things, what advice maybe can we give to some of these startups and businesses that are getting into the health and technology, just the chaos right now? Whether they're big, it could be a big company even, or a small startup. What advice can we give them that you guys have sort of gone through here that might help them work through some of these difficulties in a lean mindset?
I would definitely have people recognize that healthcare is in a transition. So aligning whatever they're doing with the priorities of the leaders in healthcare is going to be vital to the success. So, people are working on things like meaningful use with the EHR. So, showing people how the product or whatever the service links to that and can help with that, I think would be a good strategy. Or whatever problem leaders are having and the decision makers. I think those are going to be key elements to have a successful product and a successful launch with what people are doing.
Yeah, and Mark, I'd love the same thoughts from you. Just advice for startup companies, or it could be big organizations as they try to operate in this health and technology space.
Well, I mean, I think the challenge, I think the thing that companies, large or small, startup or healthcare, need to do is not just focus on cost cutting, not just focus on economies of scale. We see a lot of this in healthcare, of mergers and trying to get bigger without getting better, right, operationally, which can mean better quality, which leads to shorter waiting times, lower cost. I think sometimes startups dream and say, well, if we were just bigger, if we just had more resources. Well, the lesson from Toyota when they were developing the Toyota production system was that they didn't have many resources. Japan was decimated after World War II. And there's something to be said for lack of resources forcing creativity. I mean, not to an extreme, but I think there's something to be said. I mean, there's the expression fat, dumb, and happy. If you're too big, or you're counting on just being big, or buying solutions or buying market share, I don't know if that really leads to the most sustainable business. I think we have to focus on being better and being faster, not just being bigger or cheaper.
Absolutely. I mean, and that's great. I mean, just for me as a budding entrepreneur getting my own startup launch, that's great advice just to keep in mind, because every day, I've said it many times. I can't remember what the phrase is exactly, but just, like if only I had more cash. You think that way, but that doesn't need to be the end all, right? Like there's other ways to squeeze out great resources and great productivity out of your product, and get to where you got to get to without gobs and gobs of cash in the bank. So it's good advice. I want to kind of just quick wrap up though on a little bit more of a fun question. I didn't quite go over this with either of you, so I hope it doesn't make you too nervous. But I say it all the time. I love being an entrepreneur. It's a lot of fun. You get to meet a lot of great people and do a lot of great work. So I'm curious, just for the both of you, what your favorite part about being an entrepreneur is. We'll start with Greg.
Okay, I hadn't thought about this. So I think what I really one of the things I really enjoy about doing KaiNexus and a startup is that we're extremely nimble. So literally, at 10 a.m. on a Monday, we can have an idea, and that idea can find its way on the website by 11 or find its way in the product by next week.
Right.
And it just allows you to really be creative, and you're problem solving, and you're making decisions very quickly. And I think that it goes hand in hand, a lot of those thought processes in hand with being an ER doctor as well. And so I think that's one of the reasons why I was probably attracted to emergency medicine, why I'm attracted to doing a company, just because you can be so quick in making decisions and altering things. And the downside of that is, you just don't know the right answer sometimes. And so you have to go ahead and just make the plunge and realize that, if it works out, that's great. If it doesn't, you'll just have to change it again. So.
But see, to build on that, I think that's the beauty of a startup, and especially the lean startup methodology. We don't know what the right answer is, so it's better to test it, measure the results, and figure it out, as opposed to big company bureaucracy that'll take forever to make a decision. And then there's no testing, because you put something in place and you either continually justify or rationalize what you did, because nobody ever wants to admit failure in a typical big bureaucratic company, and that's such a harmful, destructive thing. That's where companies start going downhill. And so that nimbleness. To answer your question, since I just jumped in, the other thing I love is the variety of what you get to do in a startup. Chief Improvement Officer, what's that mean? It means I'm not really bounded by a job title.
And it's a badass title.
You get to do a lot of different things, and it forces you to grow and stretch and develop in your career, which I appreciate.
Yeah, totally. I mean, there's so many things I've been forced to do. I mean, some of which I wanted to do, and a couple of which I definitely did not want to do. But a huge learning experience either way. I mean, so that's always something that I'm talking about with people. I'm actually going up to University of North Texas tomorrow to talk to a bunch of kids and faculty just about taking their ideas and putting them into action. And that question always comes up, like, what's the difference between like being an entrepreneur or not? And the funny thing is like as an entrepreneur, oftentimes you think, oh, well, I've got the flexibility to do what I want, right? But you actually have to work like way more hours and try way more stuff and learn a bunch of other stuff that you didn't know. But it's fun, right? Like you get to try all this stuff out.
And a lot of times people want to say, oh, I get to be my own boss.
Yeah,
ridiculous. Right. The customers are your boss, your investors. You always have a boss, but it's different in a startup.
Well, gentlemen, this has been awesome. Best of luck with everything with KaiNexus. I know I'm rooting for you guys. It'd be great to continue to work with you guys on the Health 2.0 side as well. If you guys are ever up here in Dallas, we'd love to get you guys to come out and chat with the group here in town about all the great work you're doing. So both of you, again, very much appreciate you taking the time to come out. It's been a lot of fun for me, and looking forward to chatting with you guys some more in the future.
Thanks so much. Really appreciate you having us on the show.
Yeah, thanks, Michael, and good luck with all the different endeavors and startups you're involved in, including the podcast. So welcome to the podcast world.
Appreciate it. And again, everybody, check out Mark's podcast, leanblog.org. It's a good one. So, gentlemen, we'll talk to you soon. All right, and that is it for today's show. A huge thanks again to Dr. Greg Jacobson and Mark Graban. These guys were awesome. I'm gonna have to make fun of them a little bit because I heard the doorbell ring at some point there. I'm not sure which of them it was, but calling you out right now, one of you guys. I heard the doorbell ring, so that was pretty awesome. Couple quick announcements. Next time on HealthSparx, you got to catch this. This is an amazing story. It's Amy Ohm, the founder and CEO of TreatmentDiaries.com. Amy I'm going to have to get the full story again, but I don't want to say it wrong because she's a cancer survivor. She had cancer a couple years back. Same thing. I don't want to get too much into it, but beat cancer, came back, started up her own company. Real excited to have her on the show. It's going to be one of those episodes where I just don't talk. I'm just going to let her tell the entire story because I want to hear it and I want you guys to hear it. So definitely check that out here next time on HealthSparx. Also, as I've mentioned here the last week, Stitcher Radio and iTunes, HealthSparx available there now. If you haven't checked out Stitcher Radio, come on, you've got probably an iPhone or an Android device. Stitcher Radio is like Pandora for podcasts. It's got all sorts of great stuff on there. So HealthSparx is now available there. Go and subscribe or follow it. That way you can just get all the new episodes delivered right to your phone. You can check them out. iTunes, everybody's got iTunes pretty much on their computer. So just look it up in the iTunes store. You can subscribe. Same thing, it'll deliver it straight to you and you can listen to it. Last but not least, of course, you can subscribe on the website, and that way just receive it all via email, as well as some tips, advice, other cool stuff that I get from guests that come on the show. So until next time, this was a lot of fun. Glad to be back. Looking forward to chatting with Amy Ohm here this next time. I'm Michael Walsh, your host. Talk to you soon.